Are you ready to live pain-free for 20 years? Discover the natural path to joint health. Imagine a life without the constant ache in your knees, hips, or shoulders. No more reaching for painkillers. No more sleepless nights because of discomfort. And best of all, no more worrying about what the years ahead will mean for your mobility. This course introduces a powerful, natural method to eliminate joint pain that could keep you moving comfortably for up to 2 decades. Together, we'll dive into 6 essential lessons packed with techniques, tips, and practical steps to transform your joint health. Lesson 1. Understanding joint pain. Causes and common triggers. Get to the root of why joint pain happens and identify everyday triggers to start managing it better. Lesson 2. Anti-inflammatory foods for joint health. Discover a diet designed to combat inflammation and nourish your joints from within. Lesson 3. Natural supplements to support long-term joint health. Learn about natural supplements backed by science that can protect your joints for years to come. Lesson 4. Joint-friendly exercises and stretches. Follow simple, low-impact exercises that build strength and flexibility, relieving pressure on your joints. Lesson 5. Detoxifying practices for reducing joint inflammation. Try gentle detox methods that help clear inflammation-causing toxins out of your system. Lesson 6. Mind-body techniques to manage and relieve pain naturally. Harness the power of mind-body connection to reduce pain and promote healing, even during flare-ups. If you're ready to take control of your joint health naturally, this course is for you. Join us to finally experience relief that lasts. Lesson 1. Understanding joint pain causes and common triggers. Introduction. Joint pain is a widespread issue, affecting millions of people around the globe regardless of age, gender, or lifestyle. It's a problem that sneaks up slowly for some, while others are hit suddenly, with discomfort that makes daily activities difficult, even unbearable. For many, joint pain starts as a dull ache and eventually escalates into a sharp, relentless pain that impacts everything from enjoying leisure activities to fulfilling basic daily needs. Often dismissed as a part of getting older or the inevitable result of physical exertion, joint pain is actually a complex condition with roots that run deeper than most realize. So, what's causing this persistent, pervasive problem? More importantly, how can we manage it effectively? Joint pain is not just a singular condition, but a symptom of various underlying causes that we often overlook in our busy lives. While painkillers and topical creams provide temporary relief, they don't address the root causes of joint pain. Often, people rely on these short-term fixes without exploring the primary factors behind their pain, which means they're stuck in a cycle of relief and relapse. Breaking this cycle requires a thorough understanding of the core causes of joint pain, which is the focus of our lesson today. By understanding the science of joint pain, what triggers it, why it persists, and how lifestyle plays a major role, you can uncover methods to achieve long-term relief and potentially prevent joint pain altogether. Objective of the lesson. This lesson is designed to explore joint pain beyond just symptoms, delving into its root causes such as inflammation, cartilage wear, autoimmune responses, and the impact of lifestyle factors. Understanding these elements allows individuals to better control their joint health, make informed decisions about treatments, and even adopt preventative measures. Exploring the causes of joint pain. Acute versus chronic joint pain. Understanding the types. Joint pain manifests in different forms, with 2 primary categories, acute and chronic. Acute joint pain is typically short-term, often resulting from an injury, accident, or strain on the joints. It can be intense and sharp, but usually subsides once the injury heals or inflammation decreases. For example, twisting an ankle or experiencing a sudden fall may lead to acute joint pain, which, with proper care, often resolves itself within a few weeks. Chronic joint pain is a persistent, long-lasting pain that can become part of daily life. Conditions like osteoarthritis, rheumatoid arthritis, and lupus often lead to chronic joint pain, where the discomfort doesn't just go away with time. Chronic joint pain can range from mild to severe and can drastically reduce one's quality of life, affecting sleep, mobility, and mood. These two types of joint pain are essential to understand because they often require different management approaches. Acute pain might be eased with rest, ice, and short-term medication, but chronic pain often demands a more comprehensive strategy that addresses the root of the problem. Common conditions associated with joint pain. Many conditions can lead to joint pain, but some are more prevalent and commonly known. These conditions often stem from a combination of factors, including genetics, lifestyle choices, and immune responses. Arthritis is one of the most recognized causes of joint pain, with two primary types being osteoarthritis OA, the most common form of arthritis, often referred to as wear and tear arthritis. OA occurs when the protective cartilage that cushions the ends of bones wears down over time, leading to pain, stiffness, and reduced range of motion. Rheumatoid arthritis RAW. Unlike OA, rheumatoid arthritis is an autoimmune condition where the body's immune system mistakenly attacks its tissues, particularly the lining of joints. This results in painful swelling that can eventually lead to joint deformity and bone erosion. Bursitis is another condition contributing to joint pain, characterized by inflammation of the basal fluid-filled sacs that cushion bones, tendons, and muscles near the joints. Bursitis often arises from repetitive motion or prolonged pressure on certain joints, such as those in the shoulders, elbows, and hips. Pain from bursitis can flare up during movements, making everyday tasks uncomfortable. Tendinitis is an inflammation of the tendons, which are the thick cords attaching muscle to bone. Tendinitis can cause acute joint pain and usually results from repetitive activity or sudden injury, commonly affecting the shoulders, elbows, wrists, and knees. Understanding these conditions helps paint a clearer picture of the ways joint pain manifests and the unique causes behind each type. But while these medical conditions are well documented, there are also numerous lifestyle factors that, though less obvious, play a significant role in either alleviating or exacerbating joint pain. How lifestyle factors impact joint health. Lifestyle choices may seem trivial in the grand scheme of joint pain, but they are often central to its onset and development. Three major lifestyle factors: state, stress, and physical activity have an outsized impact on joint health. Addressing these areas could potentially transform one's experience with joint pain. Diet and joint health. Food isn't just fuel for the body. It's also a source of nutrients that can either help or harm your joints. Diets high in sugar, processed foods, and unhealthy fats can promote inflammation in the body, which directly contributes to joint pain. Inflammation is the immune system's response to injury or illness, but when it becomes chronic due to a poor diet, it can lead to a constant state of pain in the joints. Conversely, a diet rich in anti-inflammatory foods like leafy greens, fatty fish such as salmon and mackerel, nuts, and berries can reduce joint pain over time. Omega-3 fatty acids, for example, are known to have a significant impact on reducing inflammation and have been shown to benefit people with rheumatoid arthritis and other inflammatory conditions. By making strategic dietary choices, individuals can lessen joint pain naturally and create a foundation for better long-term health. Stress and joint pain. It may seem surprising, but stress is a silent contributor to joint pain. Chronic stress triggers the release of cortisol, a hormone that, when elevated over long periods, can lead to inflammation in the body. Stress also increases tension in muscles, which places added pressure on the joints, worsening pain for those already struggling with joint issues. Additionally, stress often disrupts sleep, and inadequate sleep impairs the body's ability to repair itself, which is essential for maintaining healthy joints. Learning to manage stress through techniques like meditation, deep breathing exercises, and even regular physical activity can substantially reduce joint pain over time. Physical activity and joint health. Movement is essential for joint health, but it must be balanced and intentional. Physical activity promotes joint flexibility and strengthens muscles surrounding the joints, providing natural support. However, certain types of physical activities, especially high-impact sports, can strain or wear down joints over time, potentially causing or worsening joint pain. Low-impact activities such as swimming, cycling, and yoga are excellent alternatives for keeping joints in motion without risking wear and tear. Regular movement, even in moderation, prevents stiffness and maintains joint mobility, which is crucial for people with chronic joint conditions. Secret strategies for alleviating joint pain. In addition to addressing the root causes and understanding common conditions, there are some lesser-known techniques that can help with managing joint pain effectively. Hydration therapy. Water keeps joints lubricated and is essential for maintaining the fluidity of synovial fluid, the fluid that cushions and nourishes cartilage. Drinking sufficient water can reduce joint stiffness and help cartilage stay resilient. Heat and cold therapy. Alternating between heat and cold therapy can reduce inflammation and soothe joint pain. Heat helps to increase blood flow and relax muscles, while cold therapy can numb sharp pain and reduce swelling. Supplements. Certain supplements, like glucosamine and chondroitin, are believed to support joint health by helping to maintain cartilage integrity. Turmeric, a spice rich in curcumin, is another powerful anti-inflammatory agent that can alleviate pain in arthritic patients when taken regularly. Mindfulness and body awareness. Sometimes, pain isn't just physical, but is worsened by our perception of it. Mindfulness techniques, such as meditation and yoga, can help individuals cope with pain by improving body awareness and reducing stress, which indirectly minimizes joint pain. Consistent rest and recovery. For people who exercise or lead active lifestyles, allowing the body enough rest is essential for joint recovery and health. Without adequate rest, joints and muscles become overworked, which can lead to long-term problems. Conclusion: taking control of joint health. Joint pain doesn't have to be a lifelong sentence. By understanding its causes, types, and the various lifestyle factors that impact joint health, we can uncover new ways to manage, and in some cases, prevent it. While modern medicine offers various treatments for joint pain, a holistic approach involving diet, stress management, and mindful physical activity can be incredibly effective. This first lesson aims to empower you with the knowledge needed to take control of your joint health. By adopting these insights and implementing gradual lifestyle changes, you may not only find relief from joint pain, but also set yourself up for a lifetime of healthier, pain-free movement. Lesson 2. Anti-inflammatory foods for joint health. Introduction. If you suffer from joint pain, you know just how disruptive it can be. Joint pain can feel as though it takes control of your life, dictating what you can and cannot do. From difficulty moving freely to a constant, dull ache that never quite goes away. Joint pain affects everything from daily tasks to mood, limiting the freedom that many of us take for granted. The struggle isn't just physical, it's emotional too, impacting quality of life, relationships, and overall happiness. Yet, while many people focus on managing joint pain with medications, topical treatments, or physical therapy, there's a less commonly explored approach that may provide profound benefits: food. Yes, you read that right. The foods we consume every day have the power to either inflame or calm our bodies. Inflammation is a major underlying factor in joint pain, especially when it becomes chronic. But what if there was a way to fight this inflammation from within? An anti-inflammatory diet, packed with nutrient-rich foods, could be the secret weapon in alleviating joint pain naturally. By choosing the right ingredients and embracing specific nutrients, it's possible to nourish the body in a way that promotes joint health, reduces inflammation, and ultimately supports a pain-free life. This lesson will reveal the secrets of an anti-inflammatory diet, dive into key nutrients that make the difference, and provide practical meal plans to help you incorporate these powerful foods into your daily routine. Objective of the lesson. The goal of this lesson is to empower you to take control of joint health through diet. You'll learn which foods and nutrients reduce inflammation, how they support your joints, and discover simple, delicious recipes designed to reduce inflammation naturally. By the end, you'll have the tools to start nourishing your joints from within. Understanding the anti-inflammatory diet. How food fights inflammation. The concept of an anti-inflammatory diet isn't new, but recent research has deepened our understanding of how food impacts inflammation at a cellular level. An anti-inflammatory diet emphasizes whole, nutrient-dense foods that work to calm the body's inflammatory response. Unlike medications, which can bring side effects, an anti-inflammatory diet can naturally promote health, while delivering vitamins, minerals, and antioxidants essential for overall wellness. How does inflammation affect joint health? Inflammation is the body's natural defense mechanism, helping to protect it from infections, injuries, and harmful substances. However, when inflammation becomes chronic, it can turn into an internal problem. Joint tissues, in particular, are vulnerable to chronic inflammation, which leads to the breakdown of cartilage, increased pain, and even conditions like arthritis. By following an anti-inflammatory diet, you give your body the building blocks it needs to control inflammation and repair damaged tissues, potentially reducing pain and preserving joint function over time. Key nutrients in an anti-inflammatory diet for joint health. Specific nutrients have been shown to directly impact inflammation, supporting both joint health and overall vitality. Here is a look at the key nutrients that should be at the heart of any anti-inflammatory diet. Omega-3 fatty acids, the inflammation fighters. Omega-3 fatty acids, found in foods like fatty fish, flax seeds, chia seeds, and walnuts, are powerful anti-inflammatory agents. They help to balance the body's omega-6 fatty acids, which are common in processed foods and can promote inflammation when consumed in excess. Research has shown that omega-3 South can reduce the symptoms of rheumatoid arthritis and other joint-related conditions by decreasing inflammatory markers in the body. Including omega-3 rich foods in your diet may help ease joint stiffness and improve flexibility over time. Omega-3 sources: salmon, sardines, and mackerel, best choices for high omega-3 content. Flaxseed ground or in oil form for easy absorption. Walnuts, an easy snack to boost omega-3 South. Chia seeds, great in smoothies, oatmeal, or even sprinkled on salads. Antioxidants, protectors of joint tissue. Antioxidants are compounds that protect cells from damage caused by free radicals, which are molecules that can lead to inflammation and aging of tissues, including joints. Colorful fruits and vegetables, like berries, leafy greens, and bell peppers, are packed with antioxidants such as vitamin C, vitamin E, and polyphenols. These nutrients help to reduce oxidative stress, protect cartilage from wear, and support joint function. Antioxidant sources: berries, especially blueberries and strawberries, which are rich in vitamin C and polyphenols. Leafy greens like spinach, kale, and arugula, high in vitamins C and E. Nuts and seeds like almonds and sunflower seeds, which provide vitamin E. Green tea rich in polyphenols, specifically epigallocatechin gallate, EGCG, an antioxidant shown to reduce inflammation. Vitamin D, the bone and cartilage helper. Vitamin D isn't just crucial for bone health, it also plays a significant role in immune function and inflammation regulation. Low levels of vitamin D have been linked to increased inflammation, which can exacerbate joint pain. Exposure to sunlight is a primary source of vitamin D, but it's also found in foods like salmon, fortified dairy products, and egg yolks. Ensuring adequate vitamin D intake can support joint health and may improve the effectiveness of other anti-inflammatory measures. Vitamin sources: salmon, especially wild-caught, for higher vitamin D levels. Fortified dairy or plant-based milk, check the label for vitamin D fortification. Egg yolks, make sure to include the yolk, where vitamin D is concentrated. Mushrooms, especially those exposed to sunlight, which boosts their vitamin D content. Fiber, the gut's best friend. Fiber isn't just for digestion, it also plays a key role in reducing inflammation. High fiber diets have been linked to lower levels of C-reactive protein CRP, a marker of inflammation in the body. By supporting gut health, fiber promotes a balanced microbiome, which can influence immune responses and inflammation. Whole grains, beans, fruits, and vegetables are all excellent sources of fiber. Fiber sources: whole grains such as oats, quinoa, and brown rice. Legumes like lentils, chickpeas, and black beans. Fruits such as apples, bananas, and pears, which are easy to incorporate into any meal. Vegetables, especially cruciferous ones like broccoli and Brussels sprouts. Sample recipes and meal plans for reducing inflammation. An anti-inflammatory diet doesn't have to be complicated. Here is a look at sample recipes and a meal plan that will help you integrate these powerful foods into your daily life. Sample recipes: omega-3 power salad. Ingredients: mixed greens, kale, spinach, arugula, 4 ounces of grilled salmon or sardines, 1 TBSP chia seeds, sliced avocado, handful of walnuts, dressing, lemon juice, olive oil, and a dash of black pepper. Instructions: toast greens, salmon, chia seeds, avocado, and walnuts. Drizzle with dressing and enjoy a nutrient-packed meal that's high in omega-3 south and antioxidants. Berry antioxidant smoothie. Ingredients: 1 cup mixed berries, blueberries, strawberries, 1 TBSP flaxseed, 1 handful spinach, 1 cup almond milk or another milk alternative, a touch of honey for sweetness optional. Instructions: blend all ingredients until smooth. This smoothie is packed with antioxidants, fiber, and healthy fats, making it a great breakfast or snack option. Lentil and vegetable stew. Ingredients: 1 cup lentils, 1 cup diced tomatoes, 1 carrot sliced, 1 celery stalk sliced, 2 cups vegetable broth, 1 handful kale. Seasonings: garlic, thyme, bay leaf, and turmeric. Instructions: combine lentils, vegetables, and broth in a pot. Add seasonings and cook until lentils are tender. This fiber-rich stew is filling and supportive of gut health, promoting lower inflammation levels. Sample anti-inflammatory meal plan. Day 1. Breakfast: berry antioxidant smoothie. Lunch: omega-3 power salad. Dinner: lentil and vegetable stew. Day 2. Breakfast: oatmeal topped with chia seeds, blueberries, and a sprinkle of walnuts. Lunch: grilled chicken wrapped with spinach, avocado, and bell peppers. Dinner: baked salmon with a side of quinoa and steamed broccoli. Day 3. Breakfast: Greek yogurt with strawberries, sunflower seeds, and a drizzle of honey. Lunch: mixed greens salad with chickpeas, roasted red peppers, and an olive oil vinaigrette. Dinner: brown rice with stir-fried vegetables, carrots, snap peas, and zucchini and tofu. This plan offers a diverse range of anti-inflammatory foods that can easily fit into any lifestyle. It's also customizable, allowing you to switch out proteins, grains, or vegetables to keep meals exciting while delivering all the inflammation-fighting benefits. Lesson 3. Natural supplements to support long-term joint health. Introduction. Joint pain and stiffness can make even the simplest tasks feel like monumental challenges. If you're someone who faces this daily battle, you're not alone. Millions of people experience joint pain that makes life less enjoyable and limits their ability to move freely. From simple aches to chronic stiffness, joint pain often seems relentless, and conventional treatments only provide short-term relief without addressing the underlying issues. Painkillers and anti-inflammatory drugs may offer temporary comfort, but their effects wear off, sometimes leaving the pain even more noticeable when they do. So, where does that leave you? Is there a way to support your joints in the long term, to find relief without the constant cycle of pain and medication? There just might be a hidden solution that lies not in pharmaceuticals, but in natural supplements that support joint health from within. Certain natural supplements, like turmeric, glucosamine, chondroitin, and MSM, have shown promise in relieving joint pain, improving mobility, and even protecting joint integrity over time. But these aren't just buzzwords or unproven remedies. Scientific research increasingly backs up their effectiveness for joint health. Imagine easing pain, regaining mobility, and supporting your joints' health without relying solely on medication. This lesson will introduce you to the world of natural supplements for joint health, explore their benefits, and guide you on safely incorporating them into your routine. With the right knowledge, you can begin a journey toward long-term joint health that's sustainable, natural, and free from the dependency on pharmaceuticals. Objective of the lesson. This lesson is designed to help you discover the benefits of natural supplements known for relieving joint pain and enhancing mobility. You'll learn about key supplements like turmeric, glucosamine, chondroitin, and MSM, understand how to safely add them to your wellness regimen, and gain insight into the long-term research on their impact on joint health. Natural supplements for joint health. An overview. Natural supplements offer a holistic approach to joint health that addresses both symptoms and causes. Unlike synthetic medications, these supplements are derived from natural sources, many of which have been used for centuries in traditional medicine for their healing properties. By supporting the joints with essential nutrients and anti-inflammatory compounds, these supplements can help reduce pain, improve function, and protect against further damage. Here is an in-depth look at some of the most researched and recommended supplements for joint health. Turmeric, the golden healer. Turmeric is a bright yellow spice used for thousands of years in Ayurvedic and traditional Chinese medicine. The secret behind its power lies in curcumin, the active compound that gives turmeric its vibrant color and potent anti-inflammatory properties. Curcumin is a natural antioxidant and anti-inflammatory, making it highly effective at reducing joint pain, especially for people with inflammatory joint conditions like arthritis. Studies have shown that curcumin can inhibit certain inflammatory markers in the body, helping to ease pain and prevent joint deterioration. One of turmeric's key benefits is its versatility and low risk of side effects. Curcumin supplements are available in capsules, powders, and even teas, allowing you to incorporate turmeric into your diet easily. For those looking to enhance absorption, it's recommended to take curcumin with black pepper, as it contains piperine, a compound that increases curcumin's bioavailability by up to 2,000%. How to use turmeric for joint health. Dosage. A standard dose of curcumin is 5,000,000 milligrams per day, often split into 2 doses. Tips. Look for supplements that combine curcumin with black pepper extract, piperine, or opt for turmeric tea. Precautions. While generally safe, curcumin may cause mild digestive upset in some people. Start with a lower dose and monitor your body's response. Glucosamine, the joint's best friend. Glucosamine is a naturally occurring compound found in the cartilage that cushions our joints. It's widely used to alleviate symptoms of osteoarthritis, one of the most common causes of joint pain. Glucosamine supplements typically come in two forms: glucosamine sulfate and glucosamine hydrochloride. The sulfate form is more commonly used for joint health, as it may provide sulfur, an essential component in joint repair and cartilage formation. Glucosamine helps to protect the cartilage by stimulating the production of essential molecules that keep it elastic and resilient. Over time, glucosamine can reduce joint pain and stiffness, making it easier to move freely. Some studies even suggest that glucosamine may slow the progression of osteoarthritis, particularly in the knees, making it a powerful long-term option for those with degenerative joint conditions. How to use glucosamine for joint health. Dosage. A common dosage for glucosamine sulfate is 1,500 milligrams per day, often taken in 1 or 2 doses. Tips. Look for glucosamine sulfate supplements combined with chondroitin, as these two compounds work synergistically. Precautions. Glucosamine is derived from shellfish, so people with shellfish allergies should consult their healthcare provider before use. There's also a risk of mild digestive upset. Take it with food if needed. Chondroitin, the cartilage protector. Chondroitin is another compound naturally present in cartilage, and it often appears alongside glucosamine in joint health supplements. It's primarily used to prevent cartilage breakdown and maintain joint hydration, which is essential for smooth movement. Chondroitin sulfate works by attracting water into the joint, providing lubrication and reducing the risk of cartilage damage. Many studies have found that chondroitin can decrease pain in people with osteoarthritis, especially in the knees and hips, where joint degeneration is more common. In the long term, chondroitin may help slow the progression of osteoarthritis by preserving the integrity of cartilage and supporting the joint's natural shock-absorbing capabilities. Like glucosamine, it is considered safe for most people when used as directed. How to use chondroitin for joint health. Dosage. A common dosage is 8,000,1,200 milligrams per day, usually split into 2 doses. Tips. Consider a supplement that combines chondroitin with glucosamine for enhanced effectiveness. Precautions. Chondroitin is generally safe, but may cause mild digestive side effects in some individuals. MSM-methylsulforethan, the natural anti-inflammatory. MSM is an organic sulfur compound that has gained attention for its ability to reduce joint inflammation and pain. Sulfur is crucial for joint health because it's involved in the formation of collagen, which is a building block of cartilage. MSM's primary role is to reduce inflammation, and studies have shown that it can decrease pain and improve joint function in people with arthritis. MSM works particularly well when combined with other supplements like glucosamine and chondroitin, amplifying their effects. Beyond joint health, MSM offers other benefits, such as promoting muscle recovery and supporting skin health. This makes it a versatile supplement, especially for active individuals looking to maintain both joint and overall physical health. How to use MSM for joint health. Dosage. A standard dosage for MSM is 10,003,000 milligrams per day, split into 2 or 3 doses. Tips. MSM is often available in powder form, which can be mixed with water or juice for easier consumption. Precautions. MSM is generally safe, but may cause mild side effects, such as digestive upset. Starting with a lower dose can help the body adjust. Safely incorporating supplements into your routine. Taking supplements for joint health requires some planning and attention to ensure safety and effectiveness. Here are key steps for safely introducing these 2 supplements. Start slowly. If you're new to joint supplements, start with 1 supplement at a time, such as glucosamine or turmeric. Observe how your body responds before adding another. Consult with a healthcare provider. While natural, these supplements can interact with certain medications or medical conditions. For instance, Turmeric has blood-thinning properties and may not be suitable for those on anticoagulants. Discussing your options with a healthcare provider ensures that you're making safe choices tailored to your health needs. Consider timing and dosage. Many joint supplements are most effective when taken with meals, as food can aid absorption and minimize any digestive discomfort. Pay attention to the recommended dosages and avoid taking more than suggested.